First, concerns over the spread of monkeypox. Cases have been reported throughout Europe and in the United States, including a presumptive case in Broward County. It is one of several cases being investigated in the U.S. Thanks for staying with us. I'm Felicia Rodriguez.
And I'm Tiffany Kenny. This afternoon, the CDC gave an update on where the investigations stand. Jade Jarvis joining us now in the studio, and she listened in on that telebriefing. Jade, what are local doctors telling you?
Well, Felicia, Tiffany, there are still a very small number of cases here in the United States, so doctors are really emphasizing that this isn't something to panic over. However, they are encouraging people to be aware, do their research so they know what monkeypox is and what to do if they come in contact with the virus.
Health experts are cautiously watching the monkeypox outbreak, but for now, staying calm.
I don't think we should be very frantically concerned at this time.
The virus, which is typically found in Western and Central Africa, has been popping up recently in places it typically doesn't, like parts of Europe and here in the United States. So far, the CDC confirming 1 case in Massachusetts and 4 other presumptive cases in 3 other states, including one in Broward County. They say all are men who have traveled outside of the country. Dr. Moti Ramgopal is an infectious disease doctor with HCA Florida Lawnwood and St. Lucie hospitals. He says the symptoms start out much like the flu.
So the earliest symptoms of monkeypox can be fever, and this usually followed by a rash a few days later. Something very similar to what we would have seen with shingles.
Other things to look out for: head and muscle aches and swollen lymph nodes. It's primarily spread through direct contact with skin lesions.
Less major route is respiratory droplets. So if someone has the lesions in their mouth or their nose or their upper respiratory tract, and they cough or spit, and you're within 3 feet of someone for an extended period of time, if you look at the CDC guidelines, this is what they say, then of course that can also be another form of exposure.
Dr. Raj Panjabi, who works in global health security and biodefense at the White House, says the Biden administration is taking the outbreak very seriously, working to secure a sufficient amount of vaccines and treatment, and providing guidance to health providers and officials.
If you have the symptoms of monkeypox, that the most important thing you can do is contact your healthcare provider immediately so you can get the care and treatment that's needed. You can get tested, and those who you are around and may have been exposed can also get vaccinated.
The CDC says the monkeypox and smallpox viruses are related, so the tools the U.S. has to fight smallpox can be utilized for the monkeypox outbreak. Right now, they're in the process of releasing the Jynneos vaccine, which is a smallpox vaccine, to high-risk, close contacts of some of the early monkeypox patients. In studio, Jade Jarvis, WPBF 25 News.
Jade.